Hi, my name is Dr. Monica Taylor-Desir. I am a community psychiatrist in Rochester, Minnesota, and I am one of the board members for the American Psychiatric Association Foundation. I'm so grateful to be joined by Petros Levounis. I will allow him to fully introduce himself.
Hi, Monica. It's Petros Levounis, and I am an addiction psychiatrist. I'm also the president-elect of the American Psychiatric Association.
Thanks for being here. As we are in September, which is National Recovery Month, we are going to talk today a little bit about what recovery looks like and what addiction treatment looks like. A common question we see on social media and from the public is, what does addiction treatment really look like? In my practice, I explain to patients that it can be different. We look at addiction treatment from all angles. There are some folks that are interested in medication-assisted treatment, and that is not only for opiate addictions, but we also have medication-assisted treatment for alcohol addiction. And sometimes we forget about the common substance use disorders of tobacco use disorder or smoking cigarettes. We also have medications to help with that. And sometimes we as physicians forget to offer those options. But there are also some folks that would just need more intense addiction treatment, and they may look at an inpatient or residential treatment. What about your practice, Petros?
Very similar to yours, Monica. I would say that the three major blocks, excuse me, of addiction treatment in 2022 are medications, as you mentioned, psychotherapy and counseling, either in a group setting or an individual setting, either in an inpatient setting or an outpatient setting. But these are the things that really get people better. And of course, mutual help groups like Alcoholics Anonymous and a number of other mutual help programs that help our patients tremendously. Now, when you mention medications, I would really emphasize opioids and tobacco. These are really the success stories of medications for addiction treatment. The medications that we have for opioid use disorder and for tobacco use disorder, things like the patch and the gum and varenicline, and for opioids, buprenorphine and methadone. These are the medications that really have a major impact in our patients' lives. I like the medications for alcohol as well, and I prescribe them and I do use them, and I think we should be using them. But really for the opioids and tobacco is where we have done our best work.
I'm glad you brought up mutual help, but we also don't want to forget that in full or holistic treatment, many people will look towards having participation with their spiritual communities or in Native American communities with traditional ceremonies. And I think that's really important not to forget that it's not just biological, but there's so many other effects of addiction. So we know that family and friends and their support is so important.
Absolutely. I'm just going to say here that, that we get in trouble when people feel that these are mutually exclusive treatments, and they say either I'm going to go for medication or I'm going to go for a spiritual approach. And truly, they are not in combat with one another. They really work very, very well synergistically. And we have so many patients who do extremely well on medication, in psychotherapy, also going to their AA meetings or other mutual help meetings.
Great. So how might you inform a patient's family or friends on how they can best support a loved one going through addiction treatment?
This is a little tougher than it sounds. Let me just take a step back and say that it used to be that I would say to a patient, come see me when you're ready. I've got nothing to offer to you unless you are ready to change. And thankfully, we have put that aside And nowadays, we can work with patients who have very little interest in changing anything in their lives. Motivational interviewing, a particular form of psychotherapy, really helps patients who are highly ambivalent about whether they want to change anything in their lives. But recently, we have gone a step further, and we can help patients who not only have very little interest in changing anything in their lives, but also do not want to come see us. We can help patients who refuse to come see the doctor. And the way that we do that is we bring in the family. And we say, you are here to really help your loved one. It is not that you have to see a psychiatrist yourself, but you do need someone to help you navigate this very difficult terrain of recovery for your son, for your daughter, for your spouse, for your parent, for whoever it is who's struggling with addiction. And that works pretty well. In fact, what we do is we teach the family members motivational interviewing techniques so they can go and do that kind of work at home until the patient is ready to come and see us directly.
Those are very good techniques. I think the other things that I've found important in working with families that really want their loved one to heal and be in recovery is to help families to understand the chronic nature of substance use disorders. Because a lot of times people will think it's a one and done. You know, they go to treatment, they'll be better, there will never be any relapses or any other challenges. And I think it's hard sometimes for families to grasp, but sometimes the addiction and the substance use disorders have been there for a long time. And it's going to take time to heal. And it's not a straight course. Sometimes it's up and down.
Very, very true. The majority of people who at some point in their lives met criteria for a substance use disorder will end up beating the disorder. So that part is true, that actually this good news, treatment works and people end up doing well. However, the vulnerability to go back to using stays with you for a long, long time, if not for the rest of your life. Once the addiction, once the substance or the addictive behavior, like gambling and the internet and sex and things of that sort, take hold of parts of our brain, even if we manage to do well, and a lot of people do well, actually the majority of people do well, there's always a danger of rolling back to where you were at a significantly higher risk than, let's say, the general public. So that's something that people need to be aware of. And exactly as you said, it's a chronic relapsing illness, and people need to appreciate that part.
Right. I think, it's also important to remind families that, if you can help your loved one get back on track, relapses are part of the illness. It's not a failure in their character. It's also, if we compare it to diabetes, we know that sometimes we can do well with diabetes and our sugar levels are good. And then sometimes people have a hard time at managing their sugar, but we don't really blame them.
Imagine you have somebody who suffers from diabetes, comes, sees the doctor, and the doctor says, okay, or let's say high blood pressure or any one of these sorts, and say, from tomorrow, you're going to exercise 3 times a week, you're going to eat healthy, no concentrated sweets, no stress in your life, all these kind of laundry list of things that you must do. And if you do all these things, then you'll be fine. I mean, that's what kind of we expect with our patients with substance use disorders. We say, all right, if by tomorrow, you came to see me today, by tomorrow, I want you not to use, I want you to fix your life and all these things. And this is just too much, and the patients do need help.
And since it is National Recovery Month, it's important to talk about what recovery looks like. Another common question I hear is, what is recovery? Or how do I know if someone is in recovery? Petros, I'm curious to know how you might answer this question from a patient.
Yeah. In the past, we used to think that recovery was all about abstinence. As long as you don't use the substances, as long as you refrain from the addictive behavior, you'll be fine, no matter what. And we have shifted our thinking in recent years, and we define recovery more in terms of rebuilding your life, in terms of connecting with your loved ones, giving meaning to your life, having fulfillment, being happy. This matters, getting a home if you're homeless, finishing school if you're a student, getting meaningful employment. These things that really matter to people. Have a romantic relationship, have a family if you so choose, and the like. So that's how we see recovery in a much more holistic fashion. Abstinence is quite often part of recovery, but we do see it in a much broader sense.
Definitely. And I think recovery in my daily work with assertive community treatment for patients who have severe mental illness and also have substance use disorders, recovery is definitely a progress. It's the journey. It's not the end point, like, oh, I'm in recovery, I'm done. But people, again, are working towards all of those goals that you mentioned. And recovery can mean abstinence, but it also can mean I am in recovery and also utilizing harm reduction. And they're starting to decrease their use, and they're starting to look at how can I safely move towards a healthier existence.
Yes, absolutely. Everything that we recommend to our patients does have repercussions. Patients look up to us. It's an incredible privilege that we have, and we better be very serious about that privilege that the society has given us. So these days, we certainly think about harm reduction, but we also think about harm escalation. What kind of things do we do that may actually escalate harm? By not giving buprenorphine to a patient who suffers from severe opioid use disorder, we're most likely doing some harm escalation in that person's life. So let's be careful about the things that we do, but also the things that we don't do that may have detrimental effects for our patients.
Petros, thank you so much for joining the conversation. There was something you mentioned about the privilege of working with our patients, and I definitely agree that it's a privilege to walk on this journey with them, and to move towards recovery and to move towards health.
And thank you so much for joining us. If you want to learn more about addiction and addiction treatment, please visit us at the American Psychiatric Association's website, psychiatry.org. Thank you so much. Bye-bye now.